Although the heart is a contractile organ, there are other tissues besides cardiac muscle fibers in there. There are neural structures, such as the nodes and fiber of the cardiac conduction system, and there's also connective tissue or collagen and elastin acting as a mushy skeleton for the innervated myocardium. This connective tissue, it's stained in blue in this picture. And this connective tissue made of collagen, which takes up that blue stain, it's called the fibrous skeleton. It's like this big tendon. And as the myocardium, the muscle, contracts, it kind of pulls against this fibrous skeleton, much like a skeletal muscle would pull against a tendon and a bone. And over the lifetime of the heart, it's this fibrous skeleton that prevents stretching of the myocardium. The myocardium would really just be a mushy ball, and the fibrous skeleton kind of gives it more structure. The valves of the heart, all four of them, are extensions of this fibrous skeleton. And just like when you contract your bicep, pulling your lower arm to your upper arm, as the myocardium contracts, it kind of like pulls on that fibrous skeleton, and this is what causes the opening and closing of the valves. The purpose of any valve is to prevent backflow. These white structures here on the picture of the big heart, these are the AV valves, and they ensure one-way motion from the atria to the ventricle, so they don't allow blood to flow back into the atria. Let's do some arrows just to indicate the blood flow here. The atrioventricular valves, or the AV valves, they differ structurally. On the right side of the heart, we have the tricuspid valve, that's this one, and that separates the right atrium from the right ventricle. On the left side of the heart, we have the bicuspid valve, which can also be called the mitral valve, and that separates the left atrium from the left ventricle. The tricuspid has three flaps. The bicuspid has three flaps. Each flap has these strings here that are called chordae tendineae. And we'll just label that as A. And the chordae tendineae can also be called heartstrings. But what they do is they attach the flaps of each of the AV valves to the bottom of the ventricles. When the valves close, the chordae tendineae tighten and secure the flaps. And these chordae tendineae, they're stabilized by these papillary muscles. And this is a picture of a papillary muscle right here with its chordae tendineae as its flap. These papillary muscles, they contract with the heart. And the closing of the atrioventricular valves causes that first heart sound. So any faulty valve can really lead to regurgitation, which is basically backflow, right? A valve is supposed to prevent backflow. If we hear regurgitation, then that means that a valve is not functioning correctly. If an AV valve is faulty, blood in one of the ventricles is backflowing into one of the atria, and this is what is called atrial regurgitation, right? It's named for the destination of the blood, atrial regurgitation. And this causes a murmur between the first and the second heart sounds when an AV valve should be closed. Murmurs do not always indicate faulty valves. They can be caused by other abnormalities with blood flow, other heart issues, such as a ventricular septal defect. A VSD is a hole in the interventricular septum, and it causes a murmur. between the first and second heart sounds. The semilunar valves, which include the pulmonary and the aortic, are structurally similar to each other with three flaps. And this one here is our pulmonary valve. And remember, you shouldn't really be able to see the aortic valve. Actually, I shouldn't put AV, right? I should put aortic valve. You shouldn't really be able to see it on a picture like this, but we use these pictures for teaching purposes. When the heart contracts, these valves, bing, they pop open and they allow blood to flow into the pulmonary artery or into the aorta. So, a faulty semilunar valve, either one, causes backflow from these vessels into the ventricles. And so we call this ventricular regurgitation. And this leads to a murmur between the second and first heart sounds when the semilunar valves should be closed. But again, other things can cause a murmur just like that, such as a hole between the atria. Yeah, this is not an EKG. This is an audiogram. And each of these little squiggles here is the sound of a valve closing. In fact, this is the sound, the first heart sound, and this is the sound of the AV valves closing, the bicuspids and tricuspids, which matches the picture that you see up here. Between the first and the second heart sounds, the heart is pumping, or it's in systole, and it's ejecting blood. Between the second and first heart sound, and this is the first one again, the heart is in diastole, and it is filling. No, these phases are not equal in duration. As you can see, systole is about a third of the time that diastole takes. And the heart can just eject blood a lot faster than it can fill blood. If a valve fails to close correctly, I'm going to hear blood flowing through that valve between these heart sounds. I shouldn't hear anything between these heart sounds, but even the slightest opening of a valve when it should be closed causes noise. It's kind of like cracking a window in the car when you're driving on the highway. Even the smallest opening causes a whole lot of noise. So murmurs, they reflect that abnormal blood flow in the heart, and they're heard between heart sounds. Considering this definition of a murmur just being the result of abnormal blood flow, then blood flow through a ventricular septal defect or a hole in the interventricular septum would also create sound, and it does. And it mimics the sound of a systolic murmur because as the heart contracts, blood flows through the hole from the left to the right ventricle. So a ventricular septal defect is heard in systole. An atrial septal defect is heard in diastole. Okay, so the simplest definition of a murmur is that there's abnormal blood flow. The most common cause of that is a faulty valve. A systolic murmur happens when the heart is pumping and could be the result of either AV valve not working, either one. So you would expect this is systole, this is diastole. This is when the AV valves should be closed. And so if we hear a sound there, that's an AV valve murmur. This is where the SL valves should be closed. And if we hear a murmur there in diastole, it would be most likely malfunction of an SL valve. Okay, let's connect regurgitation. If an AV valve is faulty, like either of these, blood is regurgitating into atria. It's going the opposite way than it should be. That's atrial regurgitation. If either the aortic or the pulmonary valve, which is pictured here, this valve here, right, it could be the aortic or the pulmonary valve because they look very similar. But if this valve is not working here, then blood is regurgitating from a vessel back into the ventricles. And that's what's called ventricular regurgitation.